I think it's a historic moment, and I really want to thank Dr. Irshad Ahmed Memon Sahab, the leader of the Department of Health, Government of Sindh. Christina, thank you so much for joining from Italy. Adriana, of course, our longtime friend of Pakistan on MCH. Dr. Andre, who has recently joined, replacing Hannah. Dr. Kamal, again, a very long time friend. And of course, Dr. Yaz. Dr. Yaz, I know for a very long time, not only from UNICEF perspective, but he is a great countryman and his love for the people of Sindh and Pakistan. And of course, my colleagues, Dr. Tanveer and colleagues at Department of Health, MCH program, Lady Health Focus program, especially the DHOs, and those people who have been actually working at different levels of the supply chain of the maternal and child health and LHW program in the Department of Health. I'm really thankful to all of you. I know it has been a journey of only 1 year time, but as Dr. Yas said, our conversation actually started back in 2017 when we were trying to look at what does it mean for a good example that has been set out as a reason for supply chain management system strengthening for the health sector in Pakistan. More than myself, you know that supply chain management is something that is very pivotal, that is very important and essential component of any business, whether it is public sector, private sector, military or forces. But I think in Pakistan, the supply chain management came as a very important realization back in 2009 when USAID gave a seed money of about $1.2 million to start kicking off with a contraceptive supply chain to make a dent on maternal and child health in the country. As you know, the situation is not as good as we would like to. With all these graduations that Pakistan has been actually doing over the period of time, from poor country to middle income country, and I think this is a time of change where many things are happening at structural levels, where priorities at the prime minister level, at the provincial leadership, chief ministers, and all those who are in the bureaucracy and technocracy are actually looking at Pakistan from a very different perspective. So I take it as a very opportune time. And I know we have been discussing it with Dr. Hannah and Dr. Humaira at the national level before Dr. Andre joined. And it has been a great privilege for me. I'll just walk you through very briefly in 3-4 slides as to what has happened. But I can guarantee you that the foundation that we have laid, and as Dr. Yas said, from contraceptive LMIS to EPI LMIS and now MCH LMIS, this is going on. And this is one foundation that has been very amicably used for COVID-19 supply chain responsiveness. And I know that my colleagues in UNICEF and the ministry know it very well. That the Ministry of National Health Services, Dr. Safi, who is here. Sorry, I didn't name Dr. Safi is kindly here, but Dr. Safi, with his team in Abdullah Khan and others, under the leadership of Dr. Zafar, is actually making sure that the foundations that the federal ministry has laid out for supply chain management systems should be seen as writ of the government, as systems and standards from the government side. And they should be adapted, modified, and used for different aspects of the supply chain. So not only that this is COVID-19 that we have been able to respond to, but also the Prime Minister initiative where DG Saab is very much involved. We had a conversation with Dr. Zafar yesterday. Is the hepatitis C elimination program, which is again, $800 million, kind of supply chain, which will be actually founded on information system based on the LMIS, and that I'll be talking about. So, Dr. Safi, from the core of my heart, you are your change for Pakistan. You're doing a great support and providing leadership in terms of how the essential ingredients of health systems can be actually addressed from the very foundation of the health system itself. As we know that without supply chains, health systems just cannot appropriately work actually. Next slide. So in this slide, you will see that, we started with 5 districts in Punjab, but Sindh was very opportune in terms of having this. Dr. Shad, I know that, we have been actually talking about this, sir, in the past, and your leadership has been very pivotal in not only shaping just, for applying it for the pneumonia and diarrhea and MCH services, but the entire inventory management portfolio of the health system at different levels at the district level, actually. So Sindh was one province where it was applied to all 29 districts of the province. And along with that, there was another exercise which was done, and that was a forecasting and quantification of MCH products for a good 5 years. And I know DG Health Sub has been very, very kind in bringing all the expertise, the gynecologists, the pediatricians, and other specialists from Sindh health sector, who actually sat down with my team, Dr. Tanveer, and our technical experts, and chalked out as to what the forecast should look like for the next 5 years. So the supply chain management should be directly tied with the financing, as well as what Dr. Kamal has been advocating within leadership in Sindh, where we see that the products needs to be connected with MCH policy environment. Otherwise, mere services do not provide any meaningful solutions to maternal health and child health solutions, actually. So I'm very happy that another aspect of this is that Global Action Plan for Pneumonia and Diarrhea, DCP3, but at the same time, the Sindh government, under leadership of Dr. Azra Pichoho, was the secretary, and of course, most importantly, the DG Sab, who has been, from a programmatic perspective, looking at what should it mean when supply chain management has to be responsive to different hospital settings, to primary and secondary health facilities of Sindh. And I think he is truly leading, health services from stethoscope to a datascope dimension, actually, which is extremely important in terms of creating data from the last mile at different levels of supply chain, not only just storage and distribution side, but also at the consumption sides, where BHU, RSC, Taluka, and all these health service delivery facilities report to these consumptions and storage, but also PPHI and other partners who have been walking, talking, and shouldering with the Sindh government. So this is, again, as I said, it's a historic moment, sir, and I thank government of Sindh and UNICEF leadership who have been shaping all this together to make sure that we give importance to data generation, use of data, and application of data for policy and management decision making. Amreen, next slide, please. Now here you see, that we started back in June 2019 only. It has not been a very long time that you see normally to a project discourse or a life of a project, which is really from 3 to 5 years. And I'm thankful to Gates Foundation as well, because I know that UNICEF has been advocating very strongly for Pakistan to bring, monies in different dimensions to help Pakistani children and, on the pneumonia and diarrhea side, and also on the maternal health side, I would say, aggressively, and now on COVID. So, but this journey has been short. It has been just only, I would say, active months of contribution have not been more than 8 months, where I was able to bring together a team of 44 people. UNICEF was kind enough to endorse the design. We have been discussing and deliberating in many discussions with, Sindh government at different levels to take their advice and seek their, support in terms of how we can move the design to make sure that this is a friendly system. This is not a technology for the sake of technology, but this is health service intervention combined with technology to make sure that there is a new generation of data that feeds into management of health services. And I really would like to congratulate Dr. Ayaz and Dr. Kamal, who have been walking, talking, and shouldering not only with the government of Sindh, Department of Health and DG office at different levels, but with my team as well for the last more than 3 years now. Next. Yes, so many things. Again, I'm thankful to Ms. Ida Jirma and my own, worthy Minister Sahab, Dr. Zafar Mirza, This was actually 17th of January 2019 when we had this endorsement ceremony. The two forecasts were developed by Punjab and Sindh government. And as you see, the photograph from Sindh, the DG is there, and worthy representative from Sindh government actually received the 5-year forecasting and costing of the MCH products beside Ajirma is sitting. And this was a huge success in terms of a national endorsement of collective efforts for Sindh government, which were, moved by, the national government in its earlier discussion. I remember Dr. Hana, myself, and other colleagues from UNICEF had our first meeting with Dr. Safi and his team at the national level, and it went long actually. Next slide. And again, as I said, 93 people, there are many deliberations. Whenever you evolve a system that is responsive to the needs of health workforce, you don't only take care of the policy and the politics corridors, actually. You make sure that people who are actually at the helms of, usage of the system are not only contributing to the design of the system itself, but also being trained on those systems and then applying it in their own settings. So many trainings held. 93 people have been trained. And again, I am thankful to DG Sab. He was kind not only to apply it for MCH and pneumonia and diarrhea. He called me, he sent me so many emails, and we had those discussions along with Dr. Tanveer and Dr. Kamal to see that how we can apply it for the secondary and tertiary healthcare level. So I'm very happy that the HLMIS is now an application just not for the GAPPT and MCH services and inventories, but also to the larger framework of health systems inventories in Sindh. And that I would say I would really like to congratulate DG Sab, because this was his dream to make sure that it actually transpires into a larger understanding of inventory management in the government of Sindh. Next. This is my last slide. As I said, our time has been short, 8 or 9 months of active support. The remaining was kicking in and kicking out, I would say. I know DG has been very kind, and we have been able to apply the system and design it, test it, and train the master trainers on DHQ and THQ levels. We have trained the private sector as well. But I'm sure my colleague Christina, Adriana, Dr. Andre, especially who is looking after this project, they understand it fully that the agenda is not finished actually, because we see that for gaining a maturity from design, development, and deployment of a project, it takes some time to have that behavior change in our workforce, where you need to handhold them. And as Dr. Ayaz said, supportive supervision, and making sure that we are able to be present when they need us on the ground, and helping them walk with us when they feel that difficulty. So supportive supervision, application of this larger health system, HLMIs, needs to be monitored over the period of time. And I'll stop here again by saying that I'm very thankful to the government of Sindh, especially Dr. Azra Pichoho and DG Sab, who have been actually taking this to new dimensions. And of course, Dr. Kamal, who is the representative on UNICEF behalf, and Dr. Ayaz in Sindh to take this forward. So from my side, Christina, Adriana, Humera, this is a great moment of pride, where your team members have been doing a fantastic job in Sindh and Punjab provinces, walking, talking, and shouldering with the government. And I'm sure this is not finished. This is just the beginning of another time to come in the future very soon. Thank you very much. Dr. Tanveer?